know someone who has used Planned Parenthood. Some of you may know someone who has used Planned Parenthood, but they won't admit it because of its infamous name. That's unfortunate because 1 out of 5 women will visit a Planned Parenthood at least once in their lifetime. For 95 years, Planned Parenthood has been a nationwide health care provider that charges individuals on a sliding salary scale if they don't have insurance. Most of their patients are women that are either without insurance, underinsured, or teenagers. Although controversial for the abortions they perform, Planned Parenthood's existence is an essential health service to young women. I will prove this to you first by illustrating the medical services and assistance that Planned Parenthood provides to uninsured and underinsured women. Secondly, I'll talk about the family planning that Planned Parenthood provides to women and teenagers. And thirdly, their work to educate everyone. The first thing that Planned Parenthood does is provide medical assistance to women that are not insured and underinsured. According to the U.S. Census Bureau, 16% of the population, that's about 50 million people, were uninsured in the year 2010. Among those, almost 80% were between the ages of 18 and 44 in their reproductive years. Some women in this group are not receiving yearly exams like mammograms to screen for breast cancer or pap tests to screen for cervical cancer. This isn't even counting the uninsured. By underinsured, I am speaking of not just the uninsured women, but women whose insurance will not cover all services. Myself, I have a great insurance plan through my company. It's a PPO, which means I can go almost anywhere. I pay a $15 copay, and I get almost anything. Last year, when I had to have my yearly exam, it cost me about $170 because my insurance plan doesn't pay for lab work. Many insurance plans do not cover the lab work necessary for these tests that women need once a year. If a woman is on a strict budget, do you think they're going to pay for it that year, the test? They may not, but they may put it off until next year. I mean, what's a year? But that's why Planned Parenthood is so important. According to the 2009-2010 annual report, Planned Parenthood provided over 1.5 million cancer screenings and preventative services to women who could not afford to receive health care from their normal family doctor, assuming that a family doctor existed. Another medical service that may be ignored by uninsured women are prenatal visits. Prenatal health is not always received by an expectant mother. According to the American Pregnancy Association, almost 500,000 babies are born each year that did not receive any prenatal health care. According to the U.S. Department of Health and Human Services, without prenatal care, babies are 3 times more likely to have low birth weight and 5 times more likely to die. In the 2009-2010 annual year, Planned Parenthood provided almost 32,000 prenatal services, aiding in additional healthy births in the U.S. The second essential service that Planned Parenthood provides is family planning, not only to uninsured or underinsured women, but also adults, or also teenagers. Per the Center for Disease Control and Prevention, family planning is defined as any service related to postponing or preventing conception. Not only providing contraception, Planned Parenthood provides confidentiality to teenagers. A study published in the Journal of American Medical Association surveyed sexually active teenage girls and asked them what they would do if they could no longer obtain contraceptives without telling their parents. 47% said that they would stop accessing the health clinic for any services, and only 1% said that they would stop having sex. Taking away access of a facility that offers confidentiality to teenagers doesn't prevent them from having sex. It prevents them from protecting themselves and others. According to the American Pregnancy Association, almost 500,000 babies are born to teenagers each year. Some of these teenagers won't finish school and will severely or permanently stunt their career path. According to the Center for Disease Control, the teenage pregnancy rate lowered 9% from 2009 to 2010 due to the availability of contraceptives from places like Planned Parenthood. Planned Parenthood alone provided over 2 million services for contraceptives like the condom and pill. Thirdly, Planned Parenthood provides education. People cannot make informed decisions if they do not know the facts. In a paper written by Dr. Douglas Kirby for the National Campaign to Prevent Teen and Unplanned Pregnancy, the Guttmacher Institute pointed out a key finding. Rigorous studies have not found rigid abstinent only until marriage programs to be effective, either in deterring teens from having sex or positively impacting their behavior when they do become sexually active. In contrast, a substantial number of comprehensive sex education programs were shown by such studies to be effective in delaying the initiation of sex, reducing the frequency of sex, reducing the number of sexual partners, and increasing condom or contraceptive use. Over 1 million teenagers and adults participate in Planned Parenthood's educational events each year to provide information and education regarding family planning and the prevention of teenage pregnancy. In 2008 and 2009, Planned Parenthood had the largest network of sexuality educators in the United States, empowering women and with knowledge. Therefore, due to the medical services, family planning, and education, Planned Parenthood's existence is an essential health service to young women.
All right, I think the proposition is presented, but it should be clear that that is the proposition. It's only clear because immediately what follows is a preview, and so I think the inference is pretty straightforward that that must have been the claim to begin with. So you need to draw a little bit more attention to it. The secondary points are labeled, and I thought that they were pretty clear, but they aren't always phrased as claims. They don't seem to be making inferences. They seem to be describing factual data, and so we're getting a lot of, kind of an informative speech about Planned Parenthood, and I'm looking for a clearer argument. The key term in your proposition is that Planned Parenthood's existence is essential, which seems to suggest that there are not alternatives available, or in the absence of Planned Parenthood, some problem would exist. And I think you need to develop that point a little bit more. The cancer screenings, you had a nice piece of factual data about the number of cancer screenings that they provided and the number of people who participated in the education programs. Although the impact of that is hard to measure, the cancer screenings, I think, is probably a little bit easier to measure. When it comes to prenatal services, 32,000 seems like a relatively small number. The idea that some material is not covered by insurance programs, you've got a good personal example on that. I think you need more data on that throughout the speech, suggesting that these options are not available in other places. On the information about contraception planning, for instance, you got off on a sidetrack issue about abstinence programs. I'm not sure why we're talking about that. The real question is contraceptive information available anyplace else, or is access to contraceptives going to be hindered in any way by any limitation, or even if Planned Parenthood were to disappear? And I think that there's a big presupposition here that there isn't access to those things in any other way. The survey question that you asked simply says, what would you do if you didn't have access to this with the same kind of privacy? And I think that was an interesting question, but it does contain a presupposition that the teenagers would not have access to this with privacy. I'm not exactly sure what prevents a 14-year-old, 15-year-old, 16-year-old girl from purchasing condoms just about any place, or for their partners to do the same sort of thing. The notion that Planned Parenthood is the option for getting access to these things seems to be a little bit of a built-in assumption. I thought you did a very nice job presenting to the audience, and you build a lot of credibility with the frequency with which you try and cite the factual data. All right, thank you.